Respiratory syncytial virus, RSV. What is respiratory syncytial virus, as known as RSV? Do you know if your child or someone you love is at risk for RSV? Are you passing this virus to a loved one? Miss Olivia and RSV. This is Olivia, an infant who contracted RSV. Olivia was born prematurely at 31 weeks. Shortly after arriving home from her long stay in the NICU, she contracted RSV from a brother whom only exhibited symptoms of a common cold. Olivia had the typical signs of RSV such as high temperature, runny nose, cough, irritability, lack of appetite, and difficulties breathing. Olivia's mom took her to the doctor where they did an enzyme-linked immunosorbent assay test known as ELSA by taking a specimen with nasal wash. She was then admitted to the pediatrics floor at Ball Memorial Hospital where she had IV fluids to combat dehydration, an NG tube for feedings, and was also on a ventilator. Her air was humidified as well. She was hospitalized for approximately 4 weeks before being able to go home again. This was a very difficult time for her family. They were so excited to finally have her home from the NICU for her then just to have to return to the hospital. Her family was very upset she had to be readmitted to the hospital. Olivia is at home now, healthy and thriving, but will be at a much greater risk of having asthma throughout her life. Olivia's family wants to make sure people are more educated about this virus. They wish they would have kept anyone with any type of cold symptom away from her until symptoms were gone. They said if it could help just one family not to have to go through this, it would be worth it. The look of RSV. According to the CDC, each year 75,000 to 125,000 children under age 1 are hospitalized due to the RSV infection. Almost all children are infected with this virus by their 2nd birthday. What is RSV? RSV is a very common respiratory virus that displays mild cold-like symptoms in adults and older children. It is the most common cause of bronchiolitis and pneumonia in children. Is a large contributing factor to wheezing and lower respiratory tract problems in childhood. A highly contagious virus and is related to para-influenza and mumps and measles. RSV is defined by the CDC as a respiratory virus that infects the lungs and breathing passages. Pathophysiology. RSV invades the bronchial epithelial cells, causing inflammation and edema. The membranes of the infected cells fuse with adjacent cells to form a large multinucleated cell, creating large masses of cells or syncytia. The bronchial mucosis ultimately begins to swell and the lumina fill with the mucus and exudate. Inflammatory cells infiltrate the area, resulting in the shedding of dead epithelial cells, which causes obstruction of small airway passages, resulting in hyperinflation in areas of atelectasis. Bronchial passages normally dilate on inspiration, allowing for adequate air intake, but narrow on expiration. The inflammation and exudate caused by the RSV infection, resulting in bronchial obstruction during expiration, air trapping, poor exchange of gases, increased work of breathing, and characteristic expiratory wheeze. Is your child or someone you love at risk for RSV? Was he or she born prematurely? Are they less than 6 months of age? Is he or she less than 2 with congenital heart failure or chronic lung disease?
Do they have a weakened immune system due to a medical condition or treatment? Does your child have older siblings and that attend school or daycare? Is your child exposed to cigarette smoke?
Are you passing this virus to a loved one by sneezing, coughing, or lack of hand washing? How the virus is passed. RSV can be spread when an infected person that believes they have a common mild cold coughs or sneezes into the air. This causes virus containing droplets that can infect a person if they inhale the droplets or if they come into contact with the droplets in their mouth, nose, or eyes. RSV is spread easily by physical contact of an infected person by kissing, touching, shaking hands, infected countertops, infected doorknobs, contaminated toys. RSV can live up to 6 hours on toys, clothes, bedding, and other surfaces. RSV infections generally occur in the United States from November to April. However, the timing of the season may differ among locations and from year to year according to the CDC. What are the symptoms of RSV? Bluish skin color due to lack of oxygen, breathing difficulty or labored breathing, cough, croupy cough, often described as a sill bark cough, fever, nasal flaring, rapid breathing, shortness of breath, stuffy nose, wheezing. Symptoms may vary and differ with age. Infants under age 1 are most severely affected and often have the most trouble breathing. Call your healthcare provider if breathing difficulties or other symptoms of this virus appear. Any breathing difficulties in an infant are an emergency. Seek medical attention right away. Older children usually have only mild cold-like symptoms. Symptoms usually appear 4 to 6 days after coming into contact with the virus. How is RSV treated? Mild infections go away without treatment. If severe infection, patient is hospitalized and will receive oxygen therapy, humidified air, IV fluids to rehydrate. Ventilator may be needed to assist with breathing. Albuterol, a bronchodilator to open up the airways in the lungs to make it easier to breathe. Used to treat and prevent bronchospasms. Ribavirin is an antiviral medicine that acts against diseases caused by the viruses. What can you do to help prevent RSV? A simple way to help prevent RSV infection is to wash your hands often, especially before touching your baby. It is important to make certain that other people, especially caregivers, take precautions to avoid giving RSV to your baby. Insist that others wash their hands with warm water and soap before touching your baby. Have others avoid contact with the baby if they have a cold or fever. If necessary, have them wear a mask. Be aware that kissing the baby can spread RSV infection. Try to keep young children away from your baby. RSV is very common among young children, easily spreads from child to child. Do not smoke inside your house, car, or anywhere near your baby. Exposure to tobacco smoke increases the risk of RSV illness. Avoid crowds as much as possible during RSV season. The drug Synagis is approved for the prevention of RSV disease in children younger than 24 months who are at high risk for serious RSV disease. Ask your doctor if your child is at high risk for RSV and whether this medicine can be given to your child. If you have any questions regarding RSV and your child, you should contact your family health care provider. The Center for Disease Control website is www.cdc.gov. This website has further information regarding RSV and other illnesses. Remember, if you notice your child having any problems breathing, it is a medical emergency, and you should seek medical attention right away. This is Olivia and her family now.